In this video, continuation of autoimmune disease, thyroidism. Second one is Hashimoto thyroiditis. Hashimoto thyroiditis. It is a chronic lymphocytic thyroiditis. This one lead to hypothyroidism. Okay, this one leads to hypothyroidism, not hyper. This one hypothyroidism. It is an autoimmune in nature. What is the problem here? It also occur in female 10 to 20 times more than in male. Age group little bit higher, 45 to 65. Here pathogenesis, self-tolerance. In human blood vessels, we are having two type of lymphocytes. Okay, B lymphocytes and D lymphocytes. D lymphocytes having two type of cell, CD4 cell and CD8 cell. The B lymphocytes producing antibodies, after that only it will affected. So whenever foreign particles, this one is foreign particles, enter to blood, both will get stimulated. T cell and B cell both stimulated. D cells, CD4 cell and CD8 cell, they will secrete the cytokines. So both are secrete cytokines. They directly kill foreign materials. This is cell-mediated immunity. B cells will not directly kill that foreign material. They will form antibodies. That antibodies, okay, against that antibodies will go and form antigen antibody complex. After that only it will kill. This one name is called as humoral immunity. So we have two type of immunity. Basically the cell mediated, that is T lymphocytes. Humoral immunity, that is B cells. Humoral immunity means due to antibodies, and cell mediated means directly kill the cell. So T lymphocytes directly kill the antigen by themselves. Cell mediated immunity, but humoral may not kill any antigen. They will form antibody against that, and antibody will go and form antigen antibody complex and kill it. So this is humoral, but basically the problem is that both of them against the foreign, not against the foreign, not against that cell. Okay, against that cell. But sometimes in human blood vessels, few B lymphocytes and T lymphocytes get abnormal due to some mutation. So here what is the condition? Sometimes human blood vessels, few B lymphocytes and T lymphocytes, they get abnormal due to some mutation. We are constantly exposure to environment which is having multiple mutation. We are exposed to rays, we are eating food, taking air, so they have multiple mutant. So due to some abnormal mutations, they become abnormal, they become reactive against the self antigen of fraction of it, few lymphocytes and few B lymphocytes. Here what will happen here? Backup self-tolerance. What is mean by self-tolerance? Whenever B and T lymphocytes become abnormal, it become reactive against self-antigen such as T and B lymphocytes is killed by the body. The body do apoptosis of those cell, but automatically because the cell is harmful to human body. So here whenever that mutation, if any B cell and T cells become self-reactive, our body will kill it. It will do apoptosis of that cell because the cell is against the self antigen. against the self antigen. That's why most of us don't have autoimmune diseases, because we have self tolerance. Self tolerance is present, that's why we don't have any autoimmune diseases. That is the meaning of self tolerance. Okay, presence of this self tolerance, we don't have any autoimmune diseases. That is meaning of self tolerance. But some person, this backup mechanism shut down. Okay, so it shut down, it is not working. So what will happen in those individual, you can imagine what will happen. The self tolerance is not working, the self tolerance has breakdown. B cell, B lymphocytes, D lymphocytes, which are reactive against the self antigen. They are not killed, they will survive, and it leads to autoimmune disorders. So that is the pathophysiology of Hashimoto's thyroidism. Actually, there is a breakdown of self tolerance. This one is thyroid follicular cell. In human blood, three type of cells is presented: CD4 cell, CD8 cell, and B lymphocytes. All the three form self-reactive. They against the thyroid follicles. Okay, they react against these thyroid follicles. They are they all are surviving. CD8 directly go to that epithelium and start the injury to that epithelium. So that is known as T cell mediated cytotoxicity. This CD8 cell go to this epithelium, it will cause us injury. It have that name, D cell mediated cytotoxicity. CD4 cells will secreted interferon and macrophages activation. This interferon activate macrophages that will causes injury, cell injury. So this thyroid epithelium is injured. CD8 cells also injured by CD4 cells also. Next, B lymphocytes. B cells will form autoantibodies. Okay, these will form autoantibodies. These autoantibodies will go and reacted with these thyroid follicles and antibody dependent cytotoxicity. So basically three different type of cells: CD4, CD8, and B lymphocytes. Everyone is killing the thyroid follicle. So less thyroid follicle will be surviving and most of them are killed. That leads to hypothyroidism. Hypothyroidism. Everything is happened because of one thing, the breakdown of self-tolerance. Self-tolerance not working. That's why self-reactive CD4, that self-reactive CD8, self-reactive B lymphocytes, they are surviving. They should be killed by the body, but they are not killed, they are surviving because the self tolerance is not working. Why not working in some person? Because of mutation. Two type of gene, CDLA4 cytotoxic T lymphocytes associated antigen 4, PTPN22 protein tyrosine phosphatase 22. These two genes are mutated. Now it will lead to breakdown in the self tolerance in three type of cell. What are the three type of cells? CD4, CD8, and B lymphocytes. Uh, Autoantibodies, they become surviving. The self reactive self survive. They are three type of cells are causing injury to thyroid cell. Here antibodies are forming. Now B lymphocytes antibody are forming. Antibodies are formed against which antigen? What was the antigen in Graves disease? TSH receptor. Graves disease means thyroid stimulating hormone receptor. Here two type of antigen. What are the two antigen? One is either thyroid peroxidase. Another one is thyroglobulin. So two type of antigens, thyroid peroxidase and thyroglobulin. So against antibodies, these two type of antigen are formed. So antibody are formed either against this thyroid peroxidase or thyroglobulin. These two type of antibodies are formed. They will cause destruction. So because of destruction, less D3 and D4 formation. So see here this diagram. Thyroid cell, this one is the hypothalamus, this one is the pituitary, this one is the follicular cell, follicles of thyroid. So here three type of cell is presented, T lymphocytes, CD8 and CD4 cells. Okay, here presented. There are two cell mediated. There are become self reactive, but due to breakdown of self tolerance, there are not get. There are surviving. CD4 cell will come. CD4 cell will come and destroyed. CD8 cell will come and destroyed. That B cell not directly will come. It will producing antibody. Okay. So these antibodies, two type of antibodies against this one. So all the things will destroyed here. Basically all three things destroyed this cell. Most of the cell destroying, only few cells are present. So T3 and T4 cannot synthesis. In the blood T3 and T4 level less due to positive feedback. TSH will be more. So blood abundant of TSH and less amount of T3 and T4. Hypothyroidism. This is the typical picture of hypothyroidism. So T3, T4 not synthesized. It is very less amount presented in blood due to positive feedback. Thyroid stimulating hormone will more. So abundant of TSH, less amount of T3 and T4, it leads to hypothyroidism. This one is the notes format. Next one is cross venous enlargement. Okay, here enlargement of organ. Next one is histology. Histology. Here these are lymphocytes. These one are lymphocytes. Either it may be full lymphocytes is present. Either it may be CD4, CD8 or B lymphocytes. Then entire thyroid gland. So because of that, entire thyroid gland filled with lymphocytes. Then few follicles. We know follicles are destroyed. Few follicles only presented. That few follicles also, that cell line become more thick, more eosinophil and enlargement also. So such follicular cell is known as Hurth's cell. Hurth's cell. Most of that follicle are destroyed, few only presented, that also thick one. Okay, then germinal center of lymphocytes. All the lymphocytes it forming that germinal center. This it is a circular pattern. Circular pattern. All self-reactive CD4 and CD8 lymphocytes entering into gland and forming germinal center and killing that follicle. But that surviving cells have abundant venous, few only survive. It have abundant eosinophil granular cytoplasm termed as Herders cell. So this cell name is called as Herders cell. Last, what are the symptoms it will cause? Painless enlargement of thyroid gland, fatigue, weakness, intolerance to cold, dry skin, weight gain, constipation problem, hearing loss, and excessive bleeding problem. One more important things, all the patient with that Hashimoto's thyroiditis increase risk of development of B cell non Hodgkin lymphoma, B cell non-Hodgkin lymphoma, especially marginal cell lymphoma in future. Okay, so B cell non-Hodgkin lymphoma, especially marginal cell lymphoma in future. So in this video, autoimmune disease, hypo and hyperthyroidism we discussed. First one is Graves disease. Graves disease summary. It is a autoimmune disease. Auto antibodies are formed. Okay, here auto antibodies are formed. That auto antibody are stimulatory in nature. It will stimulate. They are against the TSH receptor presented on the follicular cells. Okay, here two type of antigen. One is thyroid stimulating antigen or long acting thyroid stimulator is present. They will go to TSH receptor, stimulate TSH receptor, then TSH receptor gets stimulated and secreted more and more amount of T3 and T4. Because of negative feedback, TSH will be low in blood. It mainly affected age group 20 to 40, mainly female. Then clinical features cross mainly enlargement, microscopy. Two things are a very important one. One is that papillary enfolding and colloidal diminished. So like this only, enfolding and here diminish. Second, hypothyroidism, Hashimoto thyroiditis we discussed. This one affected 45 to 65 age group. Two type of cell, B and T lymphocytes. B lymphocytes forming antibody, T lymphocytes two type of cell, CD4 and CD8 cell. All are acting against the foreign particles. Thanks for watching.